for a little background, the reason that we are talking today about Eastern and Western medicine, how it views immunity, is because I practice integrative medicine. And for those of you who might not know what that term means, it's basically a union of Western medicine. And when I use that term, Western medicine, I mean what we associate with hospitals, with diagnostic tests, with lab work, pharmaceuticals. When I use the term Eastern medicine, and I'll go back and forth between complementary medicine, Eastern, holistic, it's all basically the same thing. So that union with Western medicine is what we call integrative. So it's taking the best of Western medicine, the best of holistic medicine, and unifying them so that patients get the most out of their care. And part of that is knowing what is appropriate at what time. And I don't want to say I ride the fence on either side, because I really don't. I practice more holistically now, but my background is Western medicine, and I fully recognize that there's a time and a place for both. There are things that holistic medicine doesn't address better than Western. If you have, we'll use the example of, like, you're having a heart attack. I'm not going to treat you holistically in that moment. You need to go to the hospital. I can treat you holistically during and after to make sure that it doesn't happen again. But in that moment, Western medicine steps in. And on the flip side of that, there are a lot of cases, and I get called from physicians that I'm affiliated with all the time, where Western medicine is like, we don't know what else to do with this person. And holistic medicine steps in and is like, this is easy for us. And we're able to correct that issue where Western medicine wasn't. So that's basically what integrative medicine is. And we really do achieve optimal health when we incorporate both. And that's what I like to do in my own practice. So I'm going to read you a really boring definition of what immunity is, but I like it, and it'll be able to give you a sense of what we're about to talk about. So immunity, and this is more from a Western medicine standpoint, is the ability of an organism to resist a toxin or infection by the action of specific antibodies that will eliminate it. And when we talk about the immune system, we're talking about a whole network of cells and organs and tissues that all work together to keep us well. So what do I do when a patient comes into my office with, we'll use a common cold, especially if this is a patient who has recurring colds throughout the year? I'm talking 3, 4, 5 colds throughout the year, or has symptoms that are very severe, or the longevity of the cold is longer than what we would expect it to be. Not the typical, we'll say 7 to 10 days. This would be a patient who is having an illness that lasts for weeks, or has one specific symptom that's not going away, like a chronic cough or something that we're just not really able to eliminate. When I see that from a Western medical, I'll go to my Western side for a minute. From the Western medical standpoint, what do I want to look at? The first thing I want to look at is systemic disorders, right? Does this person have diabetes? Because if they do, and we haven't diagnosed that yet, that's going to be a reason that we are seeing recurring colds. So that's an easy test. Let's figure that out. I might do an immunodeficiency profile, and I'm not going to bore you with all the cells that are involved in regulating the immune response, but there's 3 biggies, and I'll just mention them super quick because you might have heard of them. One of them is the T cells, and those are actually called the killer cells, and they're called that because they literally attack everything that is foreign to us. They're the ones that recognize the toxin or the pathogen and go right in. They're important. They're important because specifically they attack bacteria, they attack viruses, they attack fungal infections, So I want to look at that level. I want to look at B cells. That's more specific to bacterial infections, but it's important, and I want to see what that level is. The third thing that I might look at is what we call phagocytes, which are, they're actually really cute if you look at them under a microscope. They have little mouths, and they're the Pac-Man of the immune system. They're just going to eat everything that they recognize, and they're smart because unless they're out of whack, they're going to recognize what's foreign and what isn't, and they're going to attack any foreign entity that comes into our body. So I want to look at those three things. I want to see if they are where they're supposed to be. And if they're not, that suggests an underlying issue that might need to be addressed even more from, we can address it holistically, but from a Western medical standpoint, what we will do is give immunoglobulin therapy. And that's an IV administration of antibodies and things that stimulate antibody production. And simultaneously with that, we can do things holistically that are going to make that treatment more effective and make the patient have a better outcome in the end. But if that's the underlying issue, we address it that way. The other thing I'll do, of course, is I'll take a listen to a patient's lungs when they come in. I'm listening for certain things that are going to tell me that this patient might have underlying chronic lung disease. So just an example is if they have a prolonged expiration, right? I hear them breathe in and their expiration is prolonged. That sends up some antennae for me. There are some breath sounds, crackles is one of them, that signifies to me that there might be, this might not be a person who's catching chronic colds over and over and over again. This might be a person who is suffering from an underlying chronic lung disease that's making us think that they're catching colds, but really it's just an exacerbation of what we would call like COPD or even emphysema. So if I hear those sounds that are indicative of chronic lung disease, I want to look into that a little bit more. And of course, I'm going to ask a patient if they're on immunosuppressants. There are drugs, chemo's a big one, that suppresses the immune system. So it might not be their own body, it might be what they're taking to treat something else that's causing them to have recurrent infections. So I want to know that. Now, if I stopped there, I wouldn't really be practicing integrative medicine. So what I have to do now, if I want to truly integrate their treatment, is I have to take a look at some other lab profiles. I want to know from a nutritional and mineral standpoint, what are their vitamin D levels? What are their iron? What are their B6 and B12? Those are some biggies. So I'm going to look at that. And if I see deficiencies in any of that, that's a relatively easy fix. That might be what is causing a person's immune system not to operate at its full potential. So when I look at that, I can discuss with that patient what we might be able to do from a nutritional standpoint. And we'll talk a little bit later about, at the end, I'm going to go over all the supplements that I recommend that can help with this, with boosting your immunity. But individually, for a patient that I'm trying to get to the bottom of, I'm going to look at that stuff. What else am I going to ask? I'm going to talk about stress. And right now, I imagine if I asked any of us what our stress level is, it's probably a little bit higher than what it normally would be, only because our lives are, most of us, our lives are somewhat not what we're used to. And anytime you have to adapt, even if it's, I know some of us are getting to stay home and it's pleasant in some ways and not pleasant in others, and there's a lot of uncertainty. So what do you think is happening long term? And I'm going to call this long term because this isn't just a week of this now. This is a month going into maybe two, who knows? So what might be happening if we're all experiencing levels of stress? And never mind the people that are colleagues of mine that are in the ERs and in the ICUs, that's a whole different thing. But what happens when we have prolonged stress is that our bodies release a hormone called cortisol, which you probably have heard of before. It gets a bad rap. It's actually a really necessary hormone in our bodies. It's a steroid, and we need it for a lot of different reasons. It regulates our blood pressure. It makes us react appropriately when there's a appropriate thing to react to, like a stress response that needs immediate attention. But what happens when we have prolonged stress is that those levels are higher than what they ought to be. And when that happens, it has an effect on our immune system in the sense that we're not able to really regulate our immune response the way we're supposed to. Our inflammatory response, which is necessary in our body, is all out of whack. um, it kind of it makes it so the cells that are supposed to be reacting to these pathogens aren't developing the way they're supposed to be, and so we get sick more. And while we need cortisol, we don't need it in the levels that I might see it in a patient that's chronically stressed. So I want to find out about that. I want to ask about that and get information. And that's a test we can also do and see where your cortisol levels are. I want to talk about sleep patterns with patients, because during sleep is when our bodies sort of rejuvenate and recover. And one of the things that happens is cytokines, are these proteins that help with the immune response. Those are, studies will tell you that those are developed during resting hours. So if we're not getting adequate rest, and what I mean by that is both enough sleep and quality of sleep. So you might be sleeping 8 hours that you think you are, but you're actually not really getting that restorative sleep where these cytokines are developing and standing at the ready to attack whatever comes in. So, and one of the things about these cytokines that I like is they attack pathogens and toxins and germs before we even know we're sick. And I want to talk about that briefly, because if it gives us all any hope, because we're all logged in here, and so we're all healthy enough that we were able to log in and listen and be attentive. So we're in a good space right now. But we contact pathogens and germs and potentially deadly things really every day of our lives, all the time. And so I want to give 3 cheers to our immune systems, because we have no idea what we're coming in contact with over and over and over again, because our bodies never let us know. It does it on its own. It fights it. First, it recognizes it, then it fights it, and we're none the wiser. So if we can all rest in that a little bit, that our immune systems, our bodies, we know what to do. And there are strong pathogens out there, certainly, that are, in the forefront right now. But our bodies know what to do, and we have to trust it. But we also have to give it what it needs in order to function appropriately. So I got on my soapbox about cheering for our immune systems, but I wanted to do that because I want to make sure that we all take a deep breath and just know that, like, for the most part, like, our bodies got this. We're good. And we can do things to help it out and make it not so stressed. And one of the things, like we said, sleep. The other is diet, and I'm not going to get super into that today, but when you put good things in and you're cognizant of what you're eating and drinking, then you are putting your body in a better position to be able to do all of the things that it needs to do to fight whatever it's coming in contact with. One of the other things Eastern medicine looks at, which Western doesn't at all, is we look at tongue and pulse. So I'll look at a patient's tongue and I'm able to see, what does the color look like? Is it swollen? What does the body of the tongue look like? What is underneath those sublingual veins that are, if you look in the mirror, you'll see them underneath, those veins under. that tells me a lot about what's going on inside the body. So from an Eastern medicine perspective, I'm going to look at that. I'm going to feel the pulse. Am I feeling it from a Western standpoint? Yes, but I'm feeling it from an Eastern standpoint too, and that's different. I'm feeling, what does it feel like under my fingers? Is it soft? Is it weak? Are we skipping beat? Like, what am I feeling that, and that's training from Eastern medicine, but that tells me what might be going on inside the body. So I'm going to look at that too. So why do we get sick is a question that I get a lot. So both Western medicine and holistic medicine both look at underlying causes. We both look at that. We want to know, do you have diabetes? Are you on immunosuppressive therapy? But what Eastern medicine looks at a little bit more is it looks at two things. One is called congenital qi. And I use the word qi, it's loose. It means like life force in Eastern medicine. It's a kind of an existential term, but congenital qi is what we're born with. And that's basically like, what cards were you dealt? How healthy were your parents? How healthy were their parents? The unfortunate part about that is we can't change that. That's just what you were given. So there are people that I treat that say, my whole life I've been sick. My mother and father, their whole lives they've been sick. That's what we'll call congenital qi. It's a weaker constitution. And it does predispose you to illness. However, what I love about holistic medicine, specifically Chinese medicine, is we don't just say that's your fate, forget it. We also look at something that's called acquired qi, and that we have complete control over. Acquired qi is what we're doing in our life right now, lifestyle wise.
Is here. Oh, Jackie, you're here. I am. Yes, it
does
matter a lot to
take change in our diet. Take a look at what our diet consists of. Take a look at our sleep patterns. Take a look at what we might be doing that's either enhancing or impeding our immune system. So we're in control of that part of it. And all of that is exercise, it's diet, it's sleep, it's controlling our stress response. And we are able to do that to maximize our health. So I like that part of Eastern medicine that says, okay, this is the cards you were dealt, nothing you can do. But here's what you can do and gain a little bit of control back. And that's what I talk with my patients a lot about, how we can gain control back of that. The other thing I like that Eastern medicine does that Western medicine doesn't is we have this concept in Eastern medicine of what we call wei qi. It's a Chinese word. And I think it translates directly into defensive qi. And what that means is that if you look at it, that's the qi that's on the outside. That's our body. And I like to view it when I talk about it. It's like a goalie that is constantly on the lookout for anything that resembles something that's going to hurt us. Any pathogen, any fungus, any germ, anything. And when your wei qi is good and we have control of that, because that is controlled by what we just talked about, by the acquired qi, you can build that wei qi, that defensive qi, so that that goalie never even blinks. It's constantly on the lookout. However, when we aren't doing what we should be doing in our own lives as far as lifestyle, and it happens to all of us, there are times in our life, for one reason or another, we're not getting enough sleep. Our diet isn't great. And it's happening now because a lot of us are comfort eating, and it's fine. A lot of us are up because we're not sleeping enough. There's worry about, the economy, about how to pay our own bills, about friends and family that are getting ill. I get it. And we're all in the same boat in that. So I'm giving us all kind of a pass right now as far as our acquired qi. Like, okay, we'll get through this part and then we have to make sure we do the right thing. But when we do the right thing, that goalie is at the ready. When we don't, and maybe this is a good time to to really make sure that goalie is at the ready if you can. Um, it's on the lookout and it's looking and it's making sure before we even know it, just like those cytokines we talked about. It's like hitting the pucks left and right, and we don't even know that those pathogens were trying to get in. And Eastern medicine looks at it that way, and I like that concept. So illness, common colds in Western medicine basically fall into two categories. It's either bacterial or viral. Bacterial, you get antibiotics, whether you choose to take them or not is up to you. Viral, we address with what's called supportive care, which is just managing your symptoms. Are you in pain from a headache? Are you congested? Symptom management, and then you just ride it out. And basically, that's a lot of the parallels that are happening now with the coronavirus. Is there are things that we're able to do, and certainly depending on how severe it is, you may need a ventilator, you may need more than supportive care. But if you're dealing with it at home, it's really just supportive care. It's getting through, letting your body do its thing and addressing symptoms so that you're not in pain constantly, you don't have a headache, the congestion isn't so overwhelming that you are having trouble taking a deep breath. Um, so that's how Western medicine basically looks at the common cold, either antibiotics or supportive management, and that's kind of where it ends. Um, Holistic medicine, specifically Chinese medicine, looks at it in a much different way in the sense that, for example, when a patient comes in with a common cold, we divide it into two categories: wind cold or wind heat. So right away, it's not a common cold to me. And the way I differentiate that, with the way Chinese medicine differentiates that, just an example is wind cold is like runny nose, no sweating, thin mucus, whereas wind heat is sore throat, high fever, night sweats, like severe body aches, that kind of thing. When I look at that and I prescribe an herbal formula, there's not a catch-all herbal formula for a common cold. I need to know like what kind of cold you have before I decide which one of the formulas, and there's so many of them that address such specific symptoms. And I love that because I don't need to put everybody under this umbrella of a common cold. I can put you where you belong based on your symptoms. And the other thing that I can do from a Eastern medicine standpoint is, once we get you through that, if you're a person who catches these colds a lot, there are herbal formulas designed specifically for prevention, specifically for somebody who's predisposed to catching this stuff all the time. And so we can give that patient a formula that's really going to protect them. And in fact, one of the translations of the Eastern medicine formula is windscreen, right? It means exactly that. It's a screen that we're providing that is going to bounce all of that stuff off so that you get an extra layer of immunity when you need it. And that's a formula that I think is really efficient at helping all of us, and certainly those who are predisposed to recurrent colds and flus, to just get an extra boost, so that it doesn't happen as often. And when it does happen, it's not as severe or as prolonged. So the other thing that I want to talk about is, Yana, how am I doing on time? Okay. The other thing I wanted to talk about is what Eastern medicine does is we make links between what we see and what might be underlying. So, for example, if I have a patient who has common colds over and over and over again, but as we're talking and as I'm doing my assessment, I realize that the digestive system isn't working the way it's supposed to, then I know, because I know that 70% of our immune system is in the gut. So if that's true, and this person is having chronic, lifelong digestive system disorders, then why shouldn't I believe that if we corrected the digestive stuff, that wouldn't ultimately correct the immune response and that person wouldn't be getting sick every 6 weeks? And so that's part of what holistic medicine does that I particularly love, is that we don't treat, the branches, right? We do. I want to take care of your pain. I want to take care of the immediate issue that you have, the common cold. But what I want to do really is I want to get to the root cause. I want to get to the tree that goes into the ground. What is happening from the ground up that, if we corrected, would correct all of the branch stuff? And that's what Eastern medicine is really, really good at. And that's a link that I see so often with people who say, I'm just a person who catches colds all the time. Maybe you're not. Maybe you're a person with chronic inflammation in the gut. And so your healthy gut bacteria is doing what it's supposed to do. And your immune system originating in your gut isn't operating the way it ought to. And so that's why you're getting colds. Maybe if we fix that, not to mention that we're fixing, abdominal bloating, we're fixing like other discomforts that originate from digestive disorders. But now you're discovering that since we've done that, you went a whole year and didn't have a cold. So that's one of the things that holistic medicine does, in addition to just treating what we see. It's kind of getting to the bottom of it and fixing that part of it too. Now, I'm going to talk about exceptions, because there's exceptions to every rule. And you can take the girl out of the hospital, but you can't take the hospital out of the girl. So strep throat, I don't treat that holistically. Why? Because if I don't treat it with an antibiotic and eradicate it, it can develop into rheumatic fever, which will damage your heart valves, and now you're in big trouble. So I can give you, when we treat it with antibiotics, I'm also going to manage your symptoms holistically. I can also give you an herbal prescription, acupuncture. But for me, and I'm not speaking for every holistic practitioner out there, I'll just say for me, I have two hard lines, and one of them is strep throat because of that. The other is urinary tract infections. Why? Because if that goes untreated successfully, it leads fairly quickly to kidney infections, fairly quickly then to blood sepsis. No good. So I would much rather, and this is what integrative medicine does, I look at that and I say, these are conditions that I want to treat concurrently. I want to treat it holistically, and I will, but I also make sure that with those two conditions, they have proper Western medical care, because that's been proven to eradicate it, where it doesn't lead to these potentially deadly things. Sinus infection, I'll just use that as an example. And they, a lot of physicians want to automatically give you antibiotics. I ride that out. I let my 10-year-olds ride that out, as long as she's not super uncomfortable. My parents, I would tell to ride that out. But that's something that doesn't lead to a complication that could be potentially deadly. So it's anytime you're practicing medicine, and any healthcare practitioner, no matter what side of the fence they're on, will tell you that it's a risk versus benefit analysis. And for those two things, I really don't compromise. It's antibiotics, and then we'll treat you holistically to make sure it doesn't come back, to look at the underlying causes of, well, why are you getting 6 UTIs a year? Or why are you getting strep throat 4 times? We'll address it that way after we treat you appropriately. I had to add that in. I'd be remiss if I didn't talk about the role of acupuncture in all of this, because it's a big deal. And it's not just me. I'm a research girl, and NIH has done a study. They've done multiple studies, but one in particular about acupuncture that I really liked was a study that talked about acupuncture and the role of increasing those T cells, those killer cells. And I can send you, if you're interested in looking at the very boring and very long research article, I'm happy to send it to you. But basically, the gist of it is acupuncture has been shown to increase these T cells. And when that happens, of course, immediately our immune defense response is primed and ready. So in patients that had previous deficiency in T cells, they get acupuncture over the course of 8 or 12 weeks. And those cells are now where they're supposed to be. And I was very impressed by that. I knew it because I'm a big fan, obviously, of acupuncture, but I loved seeing it in black and white, and I loved seeing it coming from an NIH study. The study also talked about how acupuncture decreases systemic inflammation. This is particularly important right now because COVID-19 is a respiratory illness, and part of why people are getting so sick is lung inflammation. So I would love to see, and it hasn't happened yet, but I would love to see concurrently patients getting acupuncture in the hospital to address this while they're being treated via a Western, medical protocol. It hasn't happened, but this NIH study, you can't argue with that. It decreases systemic and primarily lung and respiratory inflammation. Acupuncture can also address whatever uncomfortable symptoms you're having, whether it's congestion or headache as a result of your cold. So that's also something that is really helpful. The other thing it does is it thins lung secretions. And again, this is really, really important for the coronavirus. So acupuncture has been proven by the NIH to thin those secretions so proficiently that the body can expel them on their own. Thick, heavy lung secretions are very hard to expectorate, and they pool, and that's when you end up with lung congestion. Acupuncture has been shown to thin those secretions till they're almost like water-like, and you can cough it up and get it out of your body. The last thing we'll talk about as far as acupuncture goes is that it regulates sleep. And like we talked about before, when we're getting appropriate sleep, our bodies are able to regulate itself as far as attacking anything that comes in, and you just feel better. And all of our systems from head to toe really operate better when we are getting restful sleep. And so acupuncture improves not only the time that we're asleep, it allows our body to rest longer without interruption, but it improves the quality of the sleep. So even if you're a person who works nights, let's say, and I've been there, so I know, and you're only getting 5 hours of sleep the next day, if you can make those 5 hours really good, you're going to be so much better off than even if you got 8 that wasn't so good. So acupuncture is really good at getting us down into those, the REM sleep and regulating our sleep cycle so that it's restful across the board. All right, let's talk. This is the last part of it. And I know this is probably what you guys have been waiting on. So, and that's not why I put it last. That's how it all came about. So what can we do as far as supportive supplements? What can we do to help our immune systems throughout this time, especially be as efficient as they can be? And the first thing I want to talk about is, and I feel like this gets underused, like multivitamins. I know we all grew up chewing like the Flintstones vitamins, and and then as we got older, which honestly are worthless, but as we got older, that kind of fell off for a lot of us. If you do nothing else, get yourself, but listen to this part of it, get yourself a whole food vitamin. And what I mean by that, and it will be on the label. So there's 2 types of multivitamins. There's whole food and there's synthetic. Whole food, every nutrient that's listed there, your niacin, all of it is derived from a whole food supplement. So your iron is coming from kale, your beta carotene is coming from carrots. It's coming from natural sources that our bodies recognize. Synthetic vitamins, and I don't want to use GNC as an example because they've gotten better as far as what they carry, but it used to be like all synthetic stuff, man-made in a lab with fillers. And what happens there is those nutrients, because they're man-made, because they're not natural to our bodies, they're synthetic, our bodies don't recognize it. And so it's doing what it's supposed to do. It's looking at it and it's saying, we don't recognize this. So we're going to eliminate all of this out in our urine. So maybe if you're lucky, you get like 8% of whatever is listed as far as your daily recommendation, because our bodies just don't recognize it and it's doing what it's supposed to do. However, if you implement a whole food vitamin into your daily regimen, your body recognizes that whole food vitamin. And you will see that your levels come up dramatically because our bodies go, okay, we know what this is. All right, this is kale, and this is the good stuff from the kale, and we're going to use that. And so that's why I'm a big proponent. And of course, and I'm sure Yana will give you guys my information, but if you have any questions, I'm happy to answer them. You can email me directly. And if you have any questions about the types of whole food vitamins there are out there, there's lots of them that are, well, I'll say there's a few of them that I recommend. And a lot of them are readily available at Whole Foods. Don't order them on Amazon because people tend to make up stuff. But Whole Foods is pretty good, and there's a lot of them there that I like. The second thing I want to talk about, and again, I'm going to have to quote you a boring study because I'm a research girl, but probiotics. Johns Hopkins did a research study there, and they discovered, which we kind of already knew, but I like that it was proven, that 70% of our immune response is centered in the gut. And so when we take a probiotic, we're just supplementing all of that good bacteria. We're just giving ourselves a leg up on immunity. So I highly recommend, and again, I'm happy to give my recommendations to anybody who wants them as far as probiotic goes. Oh, and there was another, I want to talk about this too, another NIH study that lactobacillus, which you'll see listed on your probiotic, stimulates those cytokines, again, that we talked about before, that helps with inflammation, helps with immunity, and those that specifically that lactobacillus will stimulate that response. So probiotic included. Vitamin D, I want you to get a liquid. And the reason for that is that our bodies recognize it more readily and that it doesn't have to break down any of the solid vitamin D. So if you can get yourself a liquid vitamin D, your body will absorb it readily. Now, as I'm rattling all of these off, I will say this. I design things specifically for patients. I'm giving you guys just sort of a broad idea of what I include, but it's specific to each person, and there might be something I would use for somebody and not use for another, or combine two things but not combine the other. So if you have questions, we can talk about it before you go out and just sort of decide on your own. But these are just generalized recommendations. So the other thing I want to talk about is liposomal vitamin C. So why liposomal? Here's why. It's wrapped in like a fat membrane. And so what that does is it protects the vitamin C as it goes through your digestive tract, which is trying to sort of get rid of it. And when that happens, by the time it gets into your bloodstream, into your cells, it's 1/4 of what it could be. When you get liposomal vitamin C, it's wrapped in this little cradle. And so your body absorbs it more readily. By the time it goes through the digestive tract and it's ready for the cells, you get like 90% of it. I'm making that number up, but it's a lot. Versus the 10% that you would have gotten if your digestive system broke it down. So if you're going to get vitamin C, which I highly recommend you do, and even now, I don't know if this has been widely published, but patients with COVID-19 are getting high doses of vitamin C because we're discovering that there's so much more to what vitamin C does in our bodies, especially from a respiratory standpoint. So why not get ahead of the game and get yourself some liposomal vitamin C? Turmeric, I like. It's an anti-inflammatory. It's an antioxidant, which basically just means that it helps regenerate cells that we need. Oil of oregano has gotten some press lately, and I have to say, I've always been a fan. What I like about this particular product is that it is effective as far as recognizing viruses and bacteria and helping the body eliminate them. And there's all kinds of studies on it too. There are some, you have to be careful as far as like dosage and the way it's formulated. So again, I'm happy to answer any of those questions, but that's another biggie that I've started incorporating just because of where we are here as far as what's going on in the world. But those are things that I really like, the things that I mentioned. And again, it's individual, but these are generalized recommendations that can help as far as boosting immunity. And I am happy to take some questions. I see some chat stuff. Yana, should I look at it? If anybody has any questions.
I have a question. Where did you, there you are. I have a question about the overuse of antibiotics and how that affects our immune systems.
So basically, I think, and again, you know, I'm a fan of antibiotics. I mean, they're there for a reason, and I take them when I need to take them. But what happens when they're overprescribed is a couple things. One is that we don't let our bodies practice fighting this stuff off, and we need to do that. Other thing that happens is that we can build up a resistance to it when it's not absolutely necessary, and then you end up with something that absolutely requires antibiotics. Your body's like, I don't really need that. I don't know what to do with this. I recognize it, and it's not doing what it needs to do. So I tend to be on the more conservative side of prescribing antibiotics, except for those two things, you know, urinary tract infection stuff that we talked about before. But I agree with you. I believe it is overprescribed. It's a script that's written for just about every sniffle and cough sometimes, and our bodies know what to do, and we can fight this stuff on our own. It gives us practice. Our immune systems need to have a little bit of, you know, kicking into high gear every now and then to fight these things that we can fight on our own when antibiotics aren't needed. So I'm glad you asked that.
You said 70% is the gut for the immunity. What's the other 30?
Just the other 30 is everything else. The other 30 is like our white blood cells, the lymphocytes that we talked about, the stuff that's circulating in our lymph that isn't originating there. And it's very hard to say for sure, you know, what percentage, but we do know that so much of it is incorporated in that area that a probiotic is going to be super useful. And, you know, we hope, of course, when our bodies are functioning properly that, yes, 70% might be in the gut and the other 30 has to kick in too. We need it all, really.
And real quick, because I'm going to go buy probiotics tomorrow, The liquid and the capsule doesn't make a huge difference?
No. And in fact, since you asked, Garden of Life has a raw enzyme probiotic that I really like. They also have one that's not raw enzyme. I think it's even called Immune Health. I don't know, but it's I think it's like 50 billion. I forget what the number is, but that particular company I like, and I've done my own research with it. But both of those are good. I would recommend both of those, either the raw enzymes or the I think it's like 50 billion. I think it even says immune on it, but Whole Foods has it.
Perfect. Thank you.
You're welcome.
Do you want to type in your email real quick, Shannon, so everyone can see it?
Did I do that right? Yeah.
Yeah.
Okay. And if anybody has specific questions, of course, like I said, email me. I am doing Zoom sessions for patients that have specific questions as far as herbal prescription goes. So I'm happy to do that if anybody feels the need for that until I am back in business. Whenever
Shannon, I had a question.
Yes, please.
If I eat yogurt that has probiotics or drink kombucha, is that enough, or do I still need to take a supplement, or how much of that would I have to eat on a daily basis in order to get my probiotics where they need to be?
I would like to chime in when you're done on that one. I can't help myself.
I'll get the bit about the yogurt.
Yeah.
So to answer your question first, no, I would always supplement with a probiotic for sure. The second part, Lou is going to hop on this too, I know, but an overconsumption of dairy, especially now that we have a respiratory issue going around,
yes,
dairy is going to increase overall phlegm in the body, which we don't want because we've got a pandemic that's respiratory in nature. I'm not saying don't eat the yogurt. I'm saying just be careful about as much dairy as you have. Don't use that as your source of probiotics. I like kombucha, I do. And I think that it's great to eat fermented foods to help with that overall probiotic issue. But I would still, and I do in my own daily life, and recommend that you include a good probiotic. And I'm not talking about what you buy at CVS, because that it's different strains, and you need a quality if you really want it to work, just like anything else. And with probiotics, honestly, you really do get what you pay for. So you will need a good quality probiotic. And like I said, Garden of Life is just one off the top of my head. That's the one I take. And I've done a lot of research on that. So.
And I just want to add about the yogurt is that mass-produced yogurt probably has no live probiotics in it. Once it gets to you, because of everything they do to it in between with the pasteurization and the all preservatives and everything they do to it, like Dannon yogurt is not the way to go if you want to have probiotics. I just wanted to add that in.
And I see a question from Janie about your probiotic sachet Progert. I don't know that one, so I'm going to look into that though, and I'll get back to you.
Oh, I got my mic on. All right, real quick, I just wanted to say, if you guys drink kombucha and you're prone to kidney stones, don't drink the kombucha. It's bubbly tea. I didn't know that last year, and I'm rocking a whole bunch of stones in my kidneys right now. I'm past one every month, so I just didn't want that to happen to anyone else.
Thanks, Mel.
You're welcome.
I remember that part of your life.
Oh, yeah, still passing them as we speak now. So, Yes, so if you're prone to the kidney stones, no kombucha, just take the probiotic pill.
Good to know.
Thanks.
Yeah. Shan, real quick.
Yeah.
So, Hayden, he's had EBV in the past,
Hmm.
and I think it's really wreaking havoc on his system. So he's been experiencing that tiredness. I don't even know when he got it, but his titers were really high. I want to say in September and October is when he really started feeling bad. We got him tested in October, and it showed that he had had it in the past. He's still tired, but I think there could be other things going on with him. I don't know if he should be taking, like you said, something that would boost his immune system, an herbal type thing to help him.
So let's talk, because I wanted to talk to you about that anyway. Let's talk
Yeah.
after,
Okay.
so a little bit more detail, and then we'll figure it out.
Okay.
I'll let you know what to do.
Okay. That sounds good.
All right. Does anybody else have any questions?
Yes, I was just wondering if you would be willing to send out a follow-up email with some of your recommendations on it and your website and stuff like that.
Yes. Absolutely. I can do that, no problem.
And we'll be posting the recording of this as well. We'll be sending it to Shannon, and it'll be on the New York Yoga Life YouTube page. If you go to our website, www.newyorkyoga.com, all of our Wednesday wellness sessions will be there as well, probably in a few days, but they will all be there soon. So another resource for you all.
Great. Well, if there's no other questions, I want to thank you guys for your attentiveness, and I hope that everybody stays healthy. And again, feel free if you have any specific questions about anything we talked about to reach out, and I'll help you as best I can.